My name is Nelly. I am from Kenya YWCA. I am a young woman champion on SRHR, that is sexual reproductive health. At the time we find that young people do not have access to these services, and it's because of the culture, because of our religion, because of our community leaders, because in the African culture, talking about sexuality or even accessing services on sexuality, for example, a young person living with HIV/AIDS would not be comfortable going to a health center to seek for advice, to seek for services, because of the discrimination they will get in there. So I would like to see an Africa where we have free and affordable SRHR services, so that young people, especially young women, because they are the most vulnerable group and they are the most people who are affected by our culture. We have teenage pregnancies, we have unsafe abortions, we have early and forced marriages. But it's because these young girls cannot access services. These young girls do not have information on SRHR services. But I want to thank all the CSOs who've come up with programs on SRHR provision, service provision in different countries, because now young people are able to access these services. They are able to know about their sexuality. They are able to know about their rights, their sexual rights. They are able to access this information through the help of mentors, through the help of religious leaders who are still a bit not so easy to work with, because they believe, and African culture believes, that sex is only for married people. So any young person trying to get help because they've contracted an STI will not be treated well, will be discriminated, and the only thing they will be told is that they've been sleeping around with men. They won't have time to find out how it happened. We have rape cases, rape victims. We do not have laws that protect rape victims. Rapists go scot-free. They're never punished. There's an example for Kenya where we had people rape a young girl, and when they were arrested, they were made to cut grass. That was the punishment they were given, and this young girl was in a wheelchair. So if we can have access to reproductive health services, access to law, if we can know exactly which channels should we follow. If I am raped, which channel should I follow? Or if I am sexually active at a young age, where should I get services? Am I able to access family planning services? Am I able to get information on abortion care or on safe abortion? Am I able to access safe abortion? So this can only be done if we provide sexual reproductive health services, and also if we can focus on comprehensive sexuality education in our schools, because parents believe that teachers have the mandate to teach their girls and young people on sexuality. Teachers also think the parents should do that. So if we have comprehensive sexuality education in our school curriculums, then these young people, and especially young girls, will be able to access information at the right time. And this will also help reduce maternal mortality. This will help reduce teenage pregnancy. This will help reduce unsafe abortion. So I believe, as a young woman, I have a voice to stand up and talk and demand that sexual reproductive health services must be provided to every young person, including those who live in rural areas, including young people with disabilities, especially young women. Thank you.